A month now into the federal vaccine rollout, the growing pains don't seem to be getting much better. After yet another record number of COVID deaths yesterday, more than 4,300. Just over 11 million first doses have been administered so far nationwide. That's a little over half the goal the Trump administration predicted they'd hit in the first 2 weeks alone. Here in Massachusetts, was a little over 3,000 first doses given per 100,000 people. We're falling behind every other New England state plus New York in administration rates. The state's more than 45,000 first responders just started getting their vaccines this week, with a new mass vaccination site at Gillette Stadium aiming to speed things up. But home health workers, who were supposed to get vaccinated this month as well, recently learned they won't be getting their shots for weeks more. And for populations set to be eligible in Phase 2, which recently now includes people over 75, things are even more confusing, with no clear information about exactly when, where, or how they'll be able to get vaccinated so far. And local health officials are complaining the state's been leaving them in the dark about nearly all of it. As Brookline's Health and Human Services head told the Boston Globe, quote, "The rollout from the governor's office and the command center has been very poor. It's very last minute." And as for the CDC's new recommendation that anyone over 65 be immediately eligible, a recommendation some states have already taken, well, the governor is defending his office's decision to hold off.
I know this isn't popular, but I really hope that early on we are able, with the vaccine that's available, to hit the populations for whom life is most at risk and for whom the healthcare system relies on. I do know that in a lot of states, people who are the same age as my kids have gotten vaccinated before people who are home health workers or healthcare workers or long-term care workers or long-term care residents. Honestly, I just don't think that's the way we should do this.
Is he right? I'm joined now by Sam Scarpino. He's director of Northeastern's Emergent Epidemics Lab, and the chief of Brookline's fire department, John Sullivan, who's also been coordinating the town's vaccine rollout as their emergency management director. And once again, I want to note for those of you who ask why we don't invite the Baker administration on when we have these discussions, I assure you we do. And we did again today, which brings our total number of requests since the start of the pandemic to 12 specifically for the governor, 17 for his public health commissioner, 21 for his health secretary, and a handful of times, including today, asking for anyone in the administration to join us. At this point, they are not even responding. Gentlemen, thank you so much for taking the time to join me. I appreciate it.
Thanks for having me.
Welcome.
Can we put up, again, if you would, a chart we did of our rankings? And this is vaccination rates of the New England states, New York, and Massachusetts. And as you see, Connecticut tops New England. New York is just ahead of us. We are dead last in New England, and New York, number 27, puts us roughly in the middle nationally. Sam, starting with you, why is one of the healthcare capitals of the world dead last in New England, and as I said, in the middle of the pack in America?
I don't actually know, to be honest with you. I find it very surprising and very concerning. We are right at the national average in terms of the percent of the population that's been covered, which I don't think is acceptable, and we're below average in terms of the proportion of delivered vaccines we've put in people's arms, which I think is very much unacceptable.
Do you have any idea, Sam, what other states are doing? You can stay in New England. What other states are doing that apparently are pumping up their numbers that we are not?
Well, I know the state of Maine, for example, has been running exercises for months and months and months now, distributing the vaccines, setting up clinics, recruiting workers to vaccinate. And I haven't seen the same kind of coordinated effort from the state. I know that the local governments have been working very hard to do the best they can, but we haven't seen the kind of coordinated effort from the state that has occurred in many of our neighboring states.
John, if I can move to you, that's what I read reports in the Globe this morning, Commonwealth Magazine. It seems that a lot of local officials like you and the head of HHS in your community are saying the communication has been poor. It is last minute. Is that the problem, the lack of coordination between the locals who are at the center of this and the state?
I believe it is, Jim. The state has been rolling out the vaccine since the federal government has gotten it to them, but it's been choppy. We've been preparing for months and months at the local level, but we didn't even know until last few weeks that they were even going to engage us to do it. And then that, request came through in mid-December, and then, the rollout got choppy from there. And so we've been ready to go at the local level, but unfortunately, there hasn't been a lot of great communication down from the top of the state government to the local officials.
Do you have an explanation? I mean, Charlie Baker is one of the smartest people I know and has a health background. Mary Lou Sutters is stunningly competent and committed. What do you ascribe this to, Chief? What's going on? Do you know?
I think they've been focused on the receiving the vaccine, but not so much on distribution. I know they do a lot of great work at the state level to try and get the information out to us, but those pathways have not traditionally been, robust for years, and local public health has been underfunded and understaffed for forever, and so it becomes difficult to do when at the last minute.
Sam, one of the things the governor said, I believe it was yesterday when a bunch of reporters pressed him on this issue, is he acknowledged it had been a bumpy start, bumpy being his word, but he blamed it on, in part at least, on the fact that there wasn't enough intelligence from the feds as to when appropriate number of doses were going to come along. He said it was getting better, but I guess my response to that is every state's in that same position. And all these other states apparently have dealt much better with that lack of transparency than we have, no?
That's one of the aspects of this that I find most perplexing. We know that Governor Baker has a lot of experience in this area. I think we've benefited from that back in the spring in terms of acquiring PPE and getting that distributed, especially when we weren't getting it from the feds. And I haven't seen that when it comes to the vaccine rollout, which is surprising.
John, back to you're on the ground. You're actually doing this thing. Is there an issue of not enough person power to administer the shots, or is that not a problem? Is that a problem?
No. At the local level, we're in really good shape with our Medical Reserve Corps and our volunteers to be able to actually give the vaccinations. We're just being told last minute what our grouping is, and then when we're going to be able to get the vaccine for that. And it's not as if we've got these people standing at the door ready to go. We have to contact them and then create the clinics and get the Medical Reserve Corps people and our volunteers in place, and then get the rollout. So it's just been a little choppy. I think we'll get, more seamless as we move along, as those communication routes become better.
And I assume there's not a lack of interest. I mean, everybody I know, and I don't know the hesitant people. I know the people who are dying, and I don't mean that literally, a very poor choice of words, who would do anything to be in a priority group and get a shot. You're not having problems on that front, are you, Chief? No.
No. We've got people who are calling and asking where they fit in, just like everybody else. And I think we need to do a better job of communicating where people actually fit in so that we can calm the angst about when a person's going to get their vaccine.
Sam, one of the things I don't understand, we played a little sound from the governor being asked the question, why are places like Maine dropped the age to 70, Connecticut to 65, New York to 65, the CDC's recommending 65, why aren't we doing it? But I say to myself, the CDC says we have almost 700,000 doses in Massachusetts. We've only done roughly 240,000 shots. So at least as the moment, supply is not our issue. How does expanding eligibility solve what problem does it solve? Is it just that if it's a larger pool, it's easier to pick people when the communication is not as smooth as it should be? Is that what it's all about?
It does certainly sound like our biggest issue right now is around communication. I've heard from many other municipalities and local leaders that they've got the volunteers, they've got the Reserve Corps they need to administer. It's just communication and coordination coming from the state that's lacking.
I want to get a quick response from both of you. The governor took some heat, and I admire him for his courage to do this. He expanded eligibility to these congregate settings, which include prisons. A lot of people aren't happy that prisoners are getting vaccinated ahead of them. Do either of you have a problem with that, by the way? Sam or John, Chief? No? Yes? No?
I personally don't. I think we have an ethical obligation as a society to
Okay.
protect those individuals.
Okay. How about it, Chief? Do you have a problem with that?
Generally speaking, no. I think congregate care settings, including prisons, are a vulnerable population that certainly needs to be prioritized.
We only have 30 seconds left, 15 for each of you. If the governor is listening, starting with you, Chief, what's the single most important thing it's got to change to make this distribution, these shots, be in people's arms faster? Quickly.
We need to know what the state's plans are prior to them rolling it out to the public. The municipalities need that information earlier.
How about it, Sam?
I agree completely. Communication and engagement with our local public health agencies and local leaders.
Fair enough. Sam Scarpino, Chief Sullivan, I really appreciate your time. Good luck with your work. Thank you much for being with me.
Thank you,
so much
Jim.
for